Hi everybody, I'm Mark Miller with Health Strategies and I'm your value-based payments educator. Thank you for watching this video on value-based payments. What is the real payment opportunity? Are you frustrated that you're not receiving enough additional payments from your value-based contracting? Are you busy managing your own responsibilities and therefore it's hard for you to get to the bottom of it? And are you concerned that a lot of the large consultants are just too expensive for you to afford? Well, I have an alternative for you at the end of this video, but let's get started with value-based payments. What is the real level of payment opportunity? So let's begin by defining what are some of the standard types of models, of value-based payment models. What I like to do is refer to these different levels as level 1 and level 2. Level 1 models are those fee-for-service reimbursement contracts that offer you additional payments for value-based initiatives. So some examples of these would be commercial payments or Medicare Advantage payments. Level 2 models, on the other hand, are those advanced payment models that require you to be a part of a clinically integrated network or an accountable care organization. The licensee bodies for the ACO and the CIN are the Federal Trade Commission, Department of Justice, and Center for Medicare and Medicaid Services. There's about 1,500 ACOs and CINs throughout the country. About half are accountable care organizations, about half are clinically integrated network. Now, you'll notice in this video that I'm not addressing certain value-based models. I'm not going to address the level 1 fee-for-service model programs that CMS calls QPP, for instance. That stands for CMS Quality Payment Program, or the Merit-Based Incentive Payment Program called MIPS. There's plenty of other people and resources that can help you with those, and really it deserves its own video individually. Okay, so some examples of level 1 commercial or Medicare value-based payment models would be Blue Cross Blue Shield's QCPI, that's Quality Care Partnership Initiative, or their PCMH, their Patient Centered Medical Home. Now they've renamed that one the Medical Home Partnership, MHP. Humana also has a level 1 value-based program called the MPPQR. That's the Model Practice Physician Quality Recognition Program. And of course, the other commercial payers like United Healthcare, Cigna, Aetna, Amerigroup, and others, they also have level 1 fee-for-service programs that offer additional payments for value-based, but theirs generally depend on your practice size and your structure. Okay, so let's move on to examples of level 2 CIN or ACO value-based payment models. The three predominant models there are large self-insured employers, Medicare Advantage, and Medicare Standard, and Medicaid Standard. Now in this large self-insured employer model, you'll also need to coordinate with the health plan's third-party administrator and also their broker consultant to achieve these shared savings goals. Now in this employer model, you will use the employer's prior health plan costs to help establish the baseline from which you will seek to share savings. There's very little risk, downside risk for this type of model, and this is why I recommend that you start with this model first, and the communication plan and the rollout of this model, generally it does coincide with the employer's enrollment period. The next level 2 model we can discuss is the Medicare Advantage model. Now, this clinically integrated network Medicare Advantage reimbursement model generally includes both the shared savings payments and payments for performing specific quality initiatives. And in this case, the commercial carriers, for instance, Blue Cross Blue Shield, Aetna, Cigna, they serve as sort of a surrogate for CMS. Typically, the payments that you receive in this type of model are paid quarterly for the quality initiatives and typically annually for the shared savings incentives. The third type of level 2 model that I wanted to share with you is the standard Medicare and standard Medicaid model. These ACO, Medicare, and Medicaid models are offered by CMS, so again, you need to make sure that you're licensed as an ACO or a CIN. Also, it's good to note that these models have very little flexibility in terms of what quality initiatives to choose. So some examples, for instance, of traditional Medicare and Medicaid value payment models include the following. 1, value-based purchasing or group purchasing, GPO models. Number 2, readmission reductions. Now this is generally a incentive that'll help you avoid penalties. And then thirdly, your hospital-acquired conditions incentive also is meant to avoid costly penalties from CMS. The next type of Level 2 model that'll allow you to achieve additional value-based payments is called the bundled payments model. For example, BPCI, the bundled payments for care improvement model. In this case, CMS will pay one combined fixed dollar payment for the hospitals, physicians, and the post-acute providers combined. Then you have the shared savings model like the Medicare Shared Savings Program, otherwise known as MSSP. So here are some of the major components of the payments you can receive under these value-based contracting models. For instance, achieving HEDIS measures, the Healthcare Effectiveness Data and Information Set, quality components measures, star rating incentive, reference bands, care coordination staffing, care management incentives, reimbursement for achieving NCQA status, shared savings incentives, annual care visit bonuses, quality thresholds, patient experience measures, access to care incentives, data exchange bonuses, medication reconciliation, and even star rating improvement payments are available to you. So the bottom line, a typical group of providers should be able to comfortably achieve around 5 to 8% incremental value-based payments over and above your fee-for-service reimbursement. Now know that this takes some time. It takes typically about 3 years to achieve this level of additional payments. Year 1 is your strategy and development year. Year 2 is your first full performance year. And then year 3 is when you're going to get paid based on how well you performed in year 2, which is your first full performance year. Okay, well that's it for this episode on value-based payments. What is the real payment opportunity? 5 to 8% if you do it right and you participate in all of the programs. Hey, let me know what you think about this episode by giving me a comment in the comments section below. And if you enjoyed this video, do me a favor, share it with your friends. And give me a thumbs up below. That'll help more people see this video. And of course, if you like what you've heard and you like the educational approach or you have any questions you'd like to ask me, hey, if you want to know how I can help you cut through the BS of these value-based payments, give me a call on my cell phone at 615-335-0503, or you can email me at mm.healthstrategies@outlook.com.